Hi YouTube, this is Dr. Margolin. Thank you again for everybody who sends us questions, participates in our program and in our channel. We got an interesting question, and the question is, help me to understand chronic pain. What kind of disease is that? Seems like a simple question, but it's actually very complex. The definition of chronic pain is pain that lasts for 3 to 6 months and it lasts beyond the natural time of the natural process of healing. In other words, if you have a cut or a bruise or any type of injury, internal organ injury, it's called acute pain. The pain is necessary warning symptom for the healing process. But chronic pain, nothing is going on. There is no healing. There is no supposedly major changes on the tissue level. So what kind of disease is that? How we understand it, how we treat it. And in order to answer this question, we will use two models, which is applicable not only to chronic pain, but to any chronic disease. First model is called Orthopedic model, which talks about the pathology, the changes in tissue. And the second one is called Psychosomatic model, which is a newer model of chronic pain. And we'll try to cover both of them today. Thank you.
Hi, my name is Shauna Thompson. I've been coming to Dr. McCullian's office for about a year and a half now. The staff and the doctor are very friendly. They really concentrate on, especially my needs, on how to get me better and get me well. I'm currently in a powered chair, and thanks to him, I've been able to get up and take at least about 5 steps a day. So I am really grateful that I have met him and been coming here.
Nowadays, it is very hard to find a doctor's office that treats you with as much respect as you would like from a family member, and that's what it is here, a family atmosphere. And when it comes to pain management, that would be exactly what you would want for your family member and for yourself, of course.
Okay, my name is Howard Barkstone. I've been coming to Dr. Margolin since 2015, and the results has been fantastic.
My name is John Florallen. I come here almost 2 years, but I like it. I like the doctor service. I'm satisfied. I'm happy.
Hi guys, the first model is orthopedic model of chronic pain. Let's take an example which is very common, low back pain. Usually it's explained as a problem with something we call disc facet complex. Let's keep it simple. This is a disc, this is a normal disc. Imagine this disc dries and becomes thinner. It puts pressure on the facet joints. These are the facet joints between these are the facet joints between two vertebral bones. These are the facet joints, and with time we develop degenerative arthritis, and the way to treat it is to inject facet joints or medial branch blocks, small nerves that innervate them. If the disc bulges, you can do an epidural injection. You can also sometimes get something we call stenosis. This is spinal canal, and it can get narrow and pinch on the nerves. Bulging disc, like if we imagine this is the disc and this is the nerve, it can pinch on the nerve. It's what many people call pinched nerve or radiculopathy or radiculitis, and cause shooting pain down the leg. And we can inject through interlaminar, transforaminal epidural injection. We can inject this area and decrease the pain. We can also, if injections don't help, we can do surgery. What is an anatomic model exists for any type of chronic pain, chronic neck pain, knee pain, shoulder pain, any type of pain, there is some anatomical problem that we can correct. So this sounds like a very logical model. So why do we need another model of pain? There are two reasons. First, many times anatomy does not correlate with the actual pain. For example, if we do MRIs on a 60-year-old person, there is about 60% chance you will have some disc problems. You will find some facet arthritis. You can also find narrowing of the canal, which is not related to his pain. And you can find people walking down the street at this age with this type of findings. They're not complaining of pain, and you can find them in pain clinics. Also, many times correction of the anatomy does not guarantee pain relief. I actually worked for 4 years for the Department of Surgery, and I've seen many patients with something called failed back or failed neck syndrome, meaning they had surgery, MRI looks great, they corrected the anatomy, they cut the lamina, they fused it, they took care of the disc, but the person is still in pain, and sometimes the pain is even worse after the surgery. Because of that and some other factors, we developed a new model of pain that I'm going to present, and then in summary, I can express our opinion, at least my humble opinion, on how we integrate the models and what is the right way of, according to our approach to understanding and treating chronic pain. Hi guys, this is Dr. Margolin again, and we're going to talk about the second theory of chronic pain, which is applicable to many other chronic diseases, called psychosomatic theory. We said that even though we can visualize certain anatomic changes related to common pain syndrome, I'm talking about chronic pain, again, that lasts more than 3 to 6 months and not associated with actual tissue injury, new tissue injury. But many times it's neither sensitive nor specific, meaning there are a lot of people with these changes with no pain, and there are people with these changes, but the pain does not match it. Does not match the anatomic origin, and when we try to correct the anatomy, it does not help the pain. So basically, in order to understand psychosomatic theory, we also need to talk a little bit about placebo effect and about power of our thoughts and belief. I don't think many of you remember, but in the 50s, there was a common surgery called mammary artery ligation. It was way before catheterization. If the person had chronic chest pain, they would cut his chest, and they would tie an artery called mammary artery. They believed that this operation causes collateral generation in the heart, and patients did get better until they decided to do a study. And at that time it was possible. Volunteers were randomized in 2 groups. They basically cut the chest, did exactly the same thing, except they didn't tie the artery. It was a sham procedure. To their astonishment, they got the same improvement in those patients. Similar study was repeated for arthroscopic knee surgery that were followed up to 2 years. And the people who got sham surgery with a cut but no actual treatment did almost as good as people who had the surgery. The similar study was done, for example, in acupuncture. Sham acupuncture also helps. Placebo acupuncture also helps. That brought people to this, it may sound like a little bit unusual theory of chronic pain, and this is the model description created by Dr. Siegel. He basically talks about start of injury. There is acute injury, right? You twisted your back, you've been in a car accident, whatever the beginning is, work-related injury. It created sensation of back pain. And then the healing begins. Let's say it takes 3 to 6 months. It could be less. And some people forget about it. But some people develop negative thoughts, believe in damaged back, worries, pessimism. That creates negative emotions, fears, frustration, anger. And by the way, there were studies For example, Framingham studies, and I'm talking about heart studies because they involved, thousands, if not of tens of thousands of patients, a very good data. So they showed, for example, people with the same anatomy, the same narrowing of coronary arteries, who believed that they're going to develop heart failure or to develop more complications, had 4 times more risk in actually having these problems than people who were more optimistic. So in our model, negative emotions causing tensing of back muscles, right? And tensing of back muscles causes sensation of pain again, and that goes in this vicious cycle. Again, nothing is going on in terms of discs, facets, nothing is really changing, but this vicious cycle keep going on, and unless you break it, you will still be in chronic pain for a very long time. And sometimes we see people who are for years in pain. And the way to break this cycle is in 3 different approaches. It's in exercise, proper exercise. And actually there were studies that showed actually people with back pain who were exposed to a more intensive proper exercise. I'm not taking go and necessarily jog or run on the treadmill or lift weights. It may not be necessarily the best idea for low back pain, but under PT guidelines, more intense exercise actually improved their condition. People who went to work earlier actually improved their sensation of pain. People who manage their negative thoughts through mindfulness, through counseling, through cognitive behavioral therapy significantly improved their pain. And people who practice relaxation and minimally invasive procedures for their muscles, including trigger points, including some other procedures, they got better. And people who change their lifestyle, who change their diet, less inflammatory diet, that's why we spend so much time on that, including eliminating sugar, turmeric, and other modalities, they actually also got better. And I would mention this, sorry we're not so artistic, but basically you get the idea, this disease tree created by Dr. Girardi, and it talks about tree that each branch symbolizes some kind of disease, arthritis, diabetes, high blood pressure. I would put obesity here. And what she says, Western medicine tries to cut the branches. What we do for arthritis, what's my medicine for arthritis? Is it in the back? Are we going to get 3 epidural? Are we going some kind of pain, give some kind of pain medication? Are we going to give statins for high cholesterol? Are we going to get insulin, or are we going to get metformin or some kind of other pill for diabetes? High blood pressure, are we going to get blood pressure pills? So we try to cut those branches. But actually, if you look at the tree with sick branches, the problem is usually in the soil, in the roots. So once you treat the soil, you can take care of many branches. And those 3 approaches is basically, like I would say, if we can say, I don't say root canal, but it's the treatment of the roots, it's the treatment of the soil. So when you check the general well-being, change the general well-being of the person, takes care of his negative thoughts, negative emotion, his tension, change his diet, change his exercise. Then you break this cycle, and then suddenly people with the same anatomy do much better. So what is the bottom line? What is our approach? Our approach is that we respect both models. I was trained as an interventionalist, and when I started, I guess I was much more aggressive and much more invasive. And as years went by, it's close to 20 years, I started to give more respect to this psychosomatic theory as well. There are definitely anatomic problems that can be addressed and should be addressed, but in my opinion, they should be addressed from a less invasive, less dangerous procedures with the changes we discussed. And sometimes when anatomy cannot be changed, or there is a big doubt if additional procedures will bring positive results, then the psychosomatic model can still give us an answer to how to treat the pain. Thank you for being with us. Thank you for your comments. And again, this is a theoretical discussion. Please talk to your provider before making any changes. Thank you.